Thank you. I'm a practicing family physician in Gurgaon, and this is all based on what I have heard and felt and seen in the last few decades of the practice that I've been doing. And as an opportunity, looking forward and predicting a few things and seeing how the shape the family practice is going to take in the next decade. So let's see. Next slide, please. This is what we are going to discuss in this session. So in 2020, this was the year the family physicians led healthcare in India and everywhere in the world. And we'll see how. What can we expect in the coming decade will be discussed next, and then how we will shape a family practice clinic, and what skills as family physicians should we try to develop, and what will be vital for us in the next decade. So we'll cover all of this one by one. Next, please. So 2020 has been a watershed year for healthcare for a lot of different reasons. And yes, this is one thing that has joined all together. Everyone in the world has been joined by this big pandemic that everyone has been gripped by. And doctors, especially family physicians, have been at the lead of this. Next slide, please. And we have led healthcare. We have led the system and shown everyone how it's to be done. So we gladly became COVID warriors. There are so many family physicians that I know who started screening OPDs, who took samples, who conducted lab, testing gladly for their patients, and we took care of mild COVID patients in wards and in at their homes, so that the capacity of hospitals and ICUs doesn't get overwhelmed. And in the meantime, in this whole process, we lost a few of our corona warriors as well, and we will continue to fondly remember them and honor them in the years to come. Next, please. Another interesting thing that happened right at the start of this lockdown was teleconsultations started to become the norm. And as family physicians, we gladly took up teleconsultations. In fact, we have been doing teleconsultations for a long time. Our patients feel so free with us that they call us at any point of time and any time of the day, and tell us what they're feeling and ask us questions and clarifications. And sometimes they even call us to say, "Oh, doctor, I have such great news. I have finally passed stool." So they are happy to share their happy news with us in all their forms. I was especially heartened to see senior family physicians take up telemed consultations and telemedicine. And that goes on to show that we can embrace technology and utilize it for the betterment of our patients when need arises. Next, please. So overall, as family physicians, we showed our resilience in the last year. We rapidly learned the management of COVID and now learned everything there is to learn about the vaccines. And we adapted our clinic processes to provide cares to patient under home isolation. Whatever help they needed, we were there for them. And in a way, the coming decade is going to be pretty much a reflection of what we have seen in this last year. And let's see in more detail how. Next slide, please. So what can we expect in the coming decade? Let's see. Next slide. So this is my predictions. I strongly feel that family physicians will be valued more. We will be trusted more. We will be respected more, and we will be paid more. I'm sure a lot of our attendees will be happy to hear the last part as well as the first three parts, but let's see how. Next slide. Next slide, please. So let's see how family physicians will be valued more. So all the stakeholders in healthcare, patients, insurance companies, healthcare institutions, employers, more and more of them are realizing the importance of the different roles played by the doctors, the family physicians. Especially, definitely, we are getting more and more recognition for our clinical skills. But in addition, there are so many other things that we do that are getting more and more respect and recognition and valued. So, communicator, what people, what most people get, uh, let's say, see the downside of healthcare today. What they're unhappy about healthcare today is the lack of communication. And this communication is our key skill, is our key role in so many different ways. And as a communicator of prognosis, of different health education topics, and as communicator within our team, and as communicator with and collaborator with other specialists, we play very, very vital roles in making healthcare easy, accessible, and affordable for our patients. And in such situations, we also act as health advocates for our patients. We don't tolerate them leading unhealthy lives. So we are there as mentor, coach, and guide for them to better their lives. And finally, because of all of this, there is more and more recognition that family physicians can provide very, very cost-effective care. If there are family physicians, competent family physicians, then the care is effective. And without family physicians, either the care is not effective at all, or it is very expensive. So it is family physicians that make the whole system as a whole cost-effective. Next slide, please. So we will also start seeing more and more trust. We already enjoy a lot of trust from our patients. But as corporate healthcare is growing in India, reaching more and more urban places, people experience it, but they also start getting disenchanted by it. They continue to be nostalgic about their trusted family doctor. Whoever moves from one city to another, they reminisce about, oh, we had such a great doctor in our hometown. It was so comfortable to visit them, and they took care of us in all our ups and downs. And they're really blessed to have a trusted family doctor. Next slide, please. And this trust is going to continue to increase in the coming decade, is what I strongly believe. Next slide, please. We will also be respected more. So there are big challenges coming in healthcare, and we have, as family physicians, very, very specific skills that are going to align with those challenges, and we will be the ones who will be respected for having those skills. So personalized medicine is going to be one big thing in the coming decade, where a lot of genomics and testing and a lot of data generated from wearables devices, that's going to make medicine very, very personalized. And that's a challenge for healthcare as a whole, but as a family physicians, it's an opportunity for us because we already are providing holistic person-centered care. So this is in a way a boon for us that we are going to have more and more resources and information available for us to provide more and more personalized care for our patients. A lot of talk is going on now about AI and automation, robotics, and whether doctors are going to be out of jobs in the next few years. But at the same time, whatever AI and automation brings, the importance of the human touch will remain. And that is, again, one of our expertise. We believe and we know, and we are there to provide the human touch in every aspect of patient care for our patients. And we are resilient to change. So we are going to embrace AI and automation and robotics and welcome that in our practices and be there to incorporate that in our practices. Now, specialization is increasing, and it's probably going to increase more and more. Where now we may have specialists for one finger and maybe only for the proximal interphalangeal joint, and that's going to be a challenge. But as family physicians, we are already doing and will continue to do a big role in helping people navigate this whole huge, vague, complex healthcare system that has been created. And especially in situations where the diagnosis is not clear or it's not clear who is the right person or the specialist to visit. So we are used to dealing with those situations and figuring out for our patients what is the best place for them to visit or what is the best thing for them to do. And because of all of this, specific skills that are going to be in huge need in the coming decade, I strongly believe that we will be receiving much more respect for having these skills. Next slide, please. Next slide. Yes. So this is an important aspect of being a private family practitioner, that we have to also look at the financial aspects of it. Now, where is this money going to come from? Is it going to come from more government jobs? Maybe government is thinking about opening more family health centers. Is there going to be some crackdown on quackery so that people, don't go to the unlicensed and unregistered quacks, rather follow with their family physicians? But I believe that the increase in remuneration is not going to come from these sources. Rather, a simple equation where if there is more value that the system feels in the family physician's consultation, that will translate to higher fee. And we saw in the last 3 slides how there is going to be more value to the family physician's consultation and skills. Every aspect, every stakeholder in the healthcare system is going to believe and realize that family physician consultation is a very valuable thing, and that will translate to higher fees. There are cashless OPD models now floated by insurance, and maybe government will also pitch in the next near future. And this gatekeeper model that is there in different countries, where patients first have to go and meet their family physicians before they can go for any surgery or specialist consultation. This model may also come in the next decade, but we'll have to see. But overall, as we get more and more respect, next slide, please. More and more respect, more and more value, more and more trust, we will be closer to this ideal of having a family physician for every family. Next slide, please. So as we move closer to this ideal, let's try to look at what will be the shape of a family practice clinic. What will be different, what will be the same. Next slide. So our family practice clinic will have to change to deal with these challenges that are going to be there in the next decade. Chronic diseases, as we know, are going to increase more and more. There is going to be more and more fragmentation of care because of more and more specialization. AI and automation, as we discussed, are going to be big challenges. And as a result of that, human interaction may reduce. And in addition, information explosion is going to continue to happen in terms of medical research on one side, and all the information that is getting downloaded and from all the wearable devices and various different places, all the information explosion is going to be difficult to take care of. In addition, care is going to be more and more protocol based, and that in a way makes things less interesting for the doctor and more standardized. And that's a two-way thing that can be seen positively as well as a challenge. Next slide, please. Now, fortunately, the opportunities lie within these challenges themselves. So as the chronic diseases increase, there is also increasing a need for and demand for preventive medicine from the patients. More and more patients are asking us for advice on preventive aspects. They're spontaneously getting preventive health checkups and then asking us to interpret them. And that is bringing another opportunity of dealing more and more with preventive medicine. Just yesterday, I was talking to a doctor, a recent family medicine graduate, who wants to start a preventive medicine clinic. So that's an opportunity right there. Now, fragmentation of care is going to be there, but at the same time, that brings us, increases the role of someone who can incorporate and integrate everything into one single place, and that is the role of the family physician. So the role of family physicians becomes even more if there is more and more fragmentation of care. In the same way, if there is more and more AI and automation, then the value of the human touch increases, and then there is more and more value to the human values that we bring in, the humanity that we bring in, the art of medicine that we are used to as family physicians. Now, technology is most likely going to reduce human interaction, but that is also going to increase the reach of our practice. So I now see, as part of my telemedicine practice, patients from all distant corners of India. In fact, a patient from US tried to reach me and say, okay, I have been strongly recommended by a colleague, and can you consult me for my high blood pressure? So the world is our oyster now, and the reach is going to increase more and more. In addition, you must have been part of now a lot of WhatsApp groups. So a lot of peer groups are happening in virtual space, and that gives us the opportunity to instantly seek advice from our doctor friends. As the protocol-based care increases, the insurance and other payers will start getting in as the care gets standardized, and they are more comfortable with the standard of care that everyone is delivering. That will bring in more and more standard payers and make it more financially lucrative for everyone to start their practice. Next slide, please. So in handling these challenges and taking care of these opportunities, this is what my vision for a family practice clinic is in the next decade. So we'll have multiple facilities under one roof, providing comprehensive care for whole family, consultation, minor procedures, vaccinations, lab collection. So all the different things that a family needs on a day-to-day care basis, we'll have it under one roof. Integrated into these clinic services will be teleconsultations and telehealth. That will become an integral part of our clinic. And home visits and community outreach activities will also be and continue to be important in reaching out to patients and people who are not able to connect with us from our clinic or through technology. Next slide, please. So there are certain principles that will help us in this family practice clinic, and two of them, patient-centered care. And we do that, and that helps us to build trust and long-term relationships with our patient. And since we have long-term relationships, we continue to provide continuity of care over several months and years from cradle to the grave. Next slide, please. Now, this care is provided by multifunctional family physicians leading the management and care. We jack of all trades, and we take care of mild to moderate illnesses of all specialties and all different things. And as we saw in the diagram of the tree, we take care of other roles and responsibilities also, including a mentor, guide, and just a friend. And our support staff is also multifunctional, taking care of the whole patient journey from their call to taking care of their registration and all of that. Next slide, please. In addition, lean setup and lean operations will help us make it financially lucrative, and continued patient-centered innovation and use of appropriate technology will also help us make it more in with the times. Next slide, please. So overall, the shape of a family practice clinic will be this: an oasis of peace, openness, and trust. Next slide, please. So what skills do we need as family physicians in the next decade to navigate the next decade, its challenges and opportunities? Next slide, please. So it's very imperative for us to stay up to date. And I'm not talking about reading books. Everything is now there on our mobile, and we can use point of care learning tools as the patient is even sitting in front of us to increase our knowledge and skill. We continue to provide cradle to grave care, end-to-end care, continuity of care, and we do that through electronic medical records. So that becomes a very integral part of it, and we'll hear more and more about all of this in the next 2 days of the conference. Next slide, please. We need to be learning more and more skills to provide personal medicine, how to apply this research evidence to individual care, and how to understand the individual needs of the patient. Human touch will continue to be important. So we need to hone our patient-centered skills, and our communication skills we need to keep on improving so that we continue to take care of patients in a humane way, holistic way. Next slide, please. We need to be comfortable with our gadgets. Telehealth will be continuing to be big. That, and then analyzing all the information. So we need to upgrade our skills in doing that as well. And finally, leadership. So care teams, healthcare workers, all of this is going to be needing leaders, and family physicians, as family physicians, we step up and take care of the leadership of all of this. And in addition, we continue to lobby for our, let's say, things that we hold true and we value. Finally, we continue to act, next slide please, we continue to act as life coach for our patients and everyone around us. Next slide please. We are friend, philosopher, and counselor for our patients and everyone around us. So this image on the right is one of my favorites, because as family physicians, we are expected to be superhuman beings and expected to do so many different things that it's almost that we are supermen. Thanks. Next slide, please. Just to summarize what we have discussed in this session. So yes, we have led from the front in the last 1 year and faced the pandemic with our eyes wide open. In the coming decade, we'll get more respect and trust. We will be valued more and paid more. Healthcare is going to face major challenges in the coming decade, but the opportunities also lie within the same challenges. The family practices will be led by multifunctional family physicians, providing patient-centered care to the whole family. And in providing all of this, technology skills as well as the human touch will be very key. So let's ensure every family has a family physician and continue to work towards this ideal. Thank you so much for listening, and I welcome any questions which may be taken at the end.